you take the problem away, you find out what's needed to solve it, and you solve it. Okay? So we want to get people who are living chaotic lives to help solve their problems, and the experience of places that have done this is that they then move into a place where they increase their self-efficacy. So then is the point to bring in mindfulness, because you can then say to them, you are more in control of your life. This will help you move on and be more in control. I think you're absolutely right. Just coming in and saying, come and meditate, or say, quit, you know? So you give them that sense of control. But
there are practical issues, but there also are significant issues around psychological engagement for people.
Possibly.
Just in terms, because the moment they start to engage, actually the trauma can start to arise, or the traumatic mechanism. So it's tricky trying to do this kind of stuff.
Yeah. I mean, just tell you another story about the Think Yes thing. The chief, that started in the Wheatley Group when the chief executive was asked to go and see a woman by a counsellor, and this woman was on antidepressants, she was on tranquilizers, she was just a basket case of problems with serious debt problems, she wasn't paying her bills and so on. And the problem was she had 2 autistic sons who couldn't be let out the house because there was no fence around the garden. They just disappeared. And so they were there 24/7, and she was completely overwhelmed. So the chief executive went and got hold of the housing officer and said, what about this fence? I know about the fence. So what's holding it up? Well, we need a health and safety assessment. And then once we've got that, we need an occupational therapy assessment. Build the fence. You know? Just build the bloody fence. Or the rules say I can't build it. I'll take responsibility. And that's the thing. Bosses take responsibility. Just do the right thing. Build the bloody fence. And that solved the problem. The woman came off all her medication and would then be in a better position, I think. So yeah, I mean, I think the problem is public sector tries to fix things with a magic wand, you know, this, you know, we have a policy for this. Actually, it's person to person that fixes problems.
One here and then here.
Yeah. And that's part of it. Not the communication, the ability to just go and do something without having to jump on the hurdles. Definitely that I say to my patients, being able to get to the well-being part, get to the part where they can actually get treatment, is effective for them.
Yeah. Well, I mean, I think we want to get to a position where we give people permission to break the rules in the interests of the individual in front of them. I mean, I can say that because Nicola Sturgeon once described my management style as proceeding until apprehended. But she was smiling when she said it. You know.
Yeah.
Just in answer to the lady in front there, I got into meditation and mindfulness way back in the 70s, and the group I walked into, I did through curiosity, and some of them were pretty rough looking. And I thought, you know, what I'm in here? And in actual fact, 5 of them were Glasgow gang members. And I stayed in that class for 3 years, once a week for 3 years. And I've never seen such a difference in people, just to answer.
Yeah, I think, I mean, there's a couple of things to pick up from that. The most recent evidence about MBCT is that it works better, or best, in people who have had adverse childhood events, that those types of people are congregated in the more deprived areas. So actually mindfulness may work much better in lower social class than upper if you could get the delivery mechanism. I don't think it's true that people, I think you're absolutely right, once people are in a group...
Can I qualify just to say they had chosen to be there?
Mm-hmm.
Yeah,
sure. They actually wanted to.
Yeah, I mean, you can't make it compulsory, but I think once people are in the group, mindfulness isn't a particular cognitive thing. I mean, I think when it's delivered in quite a middle class way, it can be a bit a bit cognitive and lots of poetry and so on and so forth. But I think the experiences of many of the mindfulness teachers here would be that working class folk get it because it's in the body. It's not a fancy cognitive thing of lots of analysis. So I think the delivery is difficult, and we know there's an inverse care law in the NHS across the board, and it applies, I'm sure, in the provision of MBCT. The other thing is that folk from I've done a lot of research on deprivation in primary care, and people in deprived areas generally quite suspicious of groups if they don't know who's going to be there, and they also often don't want to travel outside their territory, particularly younger people. So I think there's huge potential for mindfulness, particularly for younger people in poorer areas, but I think we have to go to them, not expect them to come to us. And one of the reasons I was involved with Mindfulness Scotland with Alistair, we made it part of our vision that we would try and improve the delivery of mindfulness to help reduce inequalities. I don't think we've necessarily achieved that vision, but it's an important one to hold on to. Not quite, another 10 years. As you see from all of this, it's all quite a journey. And I think this implementation stuff, okay, we've applied this to MBCT, it would apply to just about any creative innovation that goes against the grain of how things are done in public services. So it may be helpful to folk out with the kind of MBCT world. Okay. I think you have your hand up first. Is that Fiona?
Yes.
Oh, hi.
Yes. When I was looking at the bicycle model of the top down and the bottom up, I wondered what might be happening to government or board level to support mindfulness. Because I think that that's actually a very important aspect of the implementation.
Well, Harry may know better than me. At government level, within both England and Scotland, there's interest. In Scotland, there's a couple of MSPs who are particularly interested in mindfulness. There's been sort of discussions at the Parliament about mindfulness. We delivered mindfulness to one of the departments in the government many years ago. Don't think it did much good, but we did our best. So I think there is interest, okay? I think the difficulty is, I think those of us who have been sort of the sole implementers have tended to work at the NHS level, the kind of grassroots level. And you need people like that who know how to engage at the higher level. So I mean, I think Harry has done a lot to promote mindfulness in not kind of shouting about it sort of way. It's one part of the things that may be helpful. So my sense is there's a kind of appetite. But I think there's always competing priorities, and everything that Hella said applies to Scotland as much as England. You know, money big issue. Which services are going to be kept? How they're going to be delivered? There's lots of talks about transformation and so on. Nobody quite knows how that's going to happen. So my sense is there's goodwill there, but it's not going to happen on its own. We're going to have to make it happen.
My guess is that health board level is where most of the push will come from. I mean, the government will be permissive about it, stand back and say, yeah, there's a need for it, deliver it, but actually practical delivery will come from health boards.
Can I ask a question? Just curious to know, is there any measures? I mean, you're talking about outcomes, and this is the climate that a lot of NHS staff are working in, so everything is, you want to measure the efficacy of what we're doing. Is there measures that you use other than the brain scans to determine if it's been effective or not?
Yeah, so there's 5 or 6 validated measures of mindfulness, and you can use any of those to see if you've achieved a change in people's mindfulness from the beginning to the end of the course. Or you can use your usual measures of outcomes that you would probably use in your services, such as the core and
I was going to say, if you look for that mindfulness-based approaches app, there's a section on that has those measures on it, which you can access free.
Yeah. So, and if your job is to kind of look at recurrence of depression, you can measure that. It depends on, it's kind of horses for courses, but there are measures out there. There's measures of self-compassion, which seems to be a key mechanism in improvement in mindfulness courses. So I don't think measurement's a problem.
Thanks.
You don't want a target, though. Trust me.
No.
Thank you. It's really, this is rather than a question, it's just some information to share that people might be interested to know that there is Breaking the Rules Week for Better Care,
Good.
which is being suggested by the Institute for Healthcare Improvement, and it's March 27th to 31st, and there's information online about it if people want it.
I wonder where they got that.
Well done.
Psychological trauma service, and I share this lady's concerns about for very traumatised people. Mindfulness, I think, is a really important skill, but one that people who are in the middle of being very traumatised might struggle to engage with. And you were talking about your concerns about adapting mindfulness to fit the context, but when I mean, it's a skill that I would be applying in my work, but not in the kind of accepted way of 2 hours, 8 weeks.
No,
I
no,
mean, do you think it's valid to be, you know, working out how to evidence bits of mindfulness in specific populations in that?
No, I think you have to, and it's the same in the work in Pullman. You know, there's no way we could get 16-year-old male young offenders to sit and meditate for 45 minutes. So you have to adapt it to your patch. I mean, John Kabat-Zinn has always done that. So there's nothing. I think that's fine. I think that also goes in tandem with the kind of increasing evidence base for mindfulness in trauma, of which there's, you know, Alison knows the literature better than me. There's now a growing amount of RCTs which haven't yet found their way into guidelines. I think also we should remember guidelines are guidelines. Okay, it's not the law. You can break guidelines. As a GP, I break guidelines all the time. Sometimes because I don't know about them, but often on purpose. And I think so. You know, and I think it's horses for courses. And I don't work with people with severe trauma. And Alice does a lot of work with veterans and so on. And I think Alice's view is if somebody's in a really bad space with post-traumatic stress, that's not a time for mindfulness. You maybe do 6 months of talking therapy. And then bring it in. I mean, I don't think there's golden rules about it.
There are a few things. I think one thing I just want to pick up on, and I don't know whether Neil might maybe pick up on this later on in his talk, is that there is a difference between mindfulness and mindfulness-based. So there's mindfulness, so if you're doing metacognitive work or you're doing a short practice, and that's where it's an element of the treatment and it's less intensive. And that's very different to mindfulness-based, where mindfulness is a core part of that, and it's much more intensive. And if you're doing that sort of work, then actually, and again, I think it may well be picked up later on, there is a training pathway for that, and it's quite important that whether you're doing MBCT or adapting the MBCT group, that actually you do have a really solid training and you've followed that pathway. So I think when you're thinking about different populations, you need to think about what's the skill level you need to have to be able to deliver that, and what's the pathway into that. So it might be that somebody's got a background of trauma, has done a lot of one-to-one work in preparation to actually be able to really benefit from more intensive mindfulness, but they might have done other elements of mindfulness in different ways, you know, part of phase 1 type work, but much less intensive.
Okay, so stop there, I think. So thank you very much.